Hi, my name is Tabitha Sky. I'm doing a PowerPoint presentation on Guillain-Barre Syndrome in the age group of birth to 12 years old. My target audience for this presentation would be nurses who work with pediatric patients, and I would do it to provide them with education about the illness. In my presentation, I'm going to discuss how this illness affects the different body systems, the modifiable and non-modifiable risk factors, primary, secondary, and tertiary prevention, nursing interventions, treatments, and how technology is used related to this illness. Guillain-Barre syndrome, also known as GBS, is a disease that affects the peripheral nervous system. GBS starts with complaints of weakness and pain in children. The weakness usually starts in the legs and then works its way up to the body to the arms. This process is known as ascending paralysis. The progression of the paralysis can occur in days to weeks. Pain does occur in this disease, especially in children. It is the first symptom they usually experience, and because of this, it can divert from the diagnosis. GBS is the most common cause of paralysis in children. There are a couple different ways in which the cardiac system is affected when a child has Guillain-Barre syndrome. Some of the disturbances that can occur are postural hypotension, hypertension, and tachycardia. These can happen because there is more sympathetic overactivity and parasympathetic underactivity. Tachycardia is the most common problem, but usually it doesn't require any intervention. Hypertension is also a common problem. If the hypertension gets bad enough, this can be managed with medications. When there is hypertension in children, it can be followed by hypotension. Therefore, medications should be used that have a short half-life. Hypotension in these children is managed by keeping intravascular fluid volumes up and avoiding the use of diuretics. Guillain-Barre syndrome is a common cause of respiratory paralysis. Children with GBS must be watched very closely and have their respiratory system monitored frequently. The demyelination of the phrenic and intercostal nerves can decrease the mechanics of the lungs and could eventually lead to respiratory failure. With the monitoring for these patients, assessing their blood gases and pulse oximetry are not adequate for early discovery of respiratory failure. This is because with the disease, carbon dioxide retention and hypoxemia are late manifestations. It is more important in children to monitor the vital capacity, maximum inspiratory pressure, and maximum expiratory pressure. When these get to certain levels, the child is usually admitted to a pediatric intensive care unit and intubated. It takes a long time for a child to regain their ability to breathe on their own after being ventilated because of GBS. Some children who have to be mechanically ventilated will also need to have a tracheostomy placed. Hyponatremia is a common problem in children with GBS. This is due to syndrome of inappropriate antidiuretic hormone secretion, also known as SIADH, and natriuresis. Treatment for each of these is different. Both of these require replacement of sodium. SIADH also requires the patient to be on a fluid restriction, and natriuresis requires intravascular fluid volume expansion. The best way to tell the difference between these two are by measuring the central venous pressure. In Guillain-Barre syndrome, one of the main problems with the urinary system is urinary retention. Urinary function is one thing that the more severe the disease and weakness are, the more likely the bladder is to be affected. Urinary problems would more likely be seen in children who are in the ICU. Urinary dysfunction can happen because of nerve dysfunction with the pudendomotor nerve and sacral parasympathetic nerve, which causes bladder retention. This is usually treated by putting in a urinary catheter. The GI system can be affected with problems such as constipation, immotility, and ileus. Immobility, demyelinated nerves, and narcotic pain medications are likely causes of these. Because the gastrointestinal system can be affected, weight loss and dehydration can occur. If there is a chance of these, nutritional support and IV hydration should be started as soon as possible to avoid any fluid or electrolyte disturbances. If an ileus occurs, enteral feedings should be decreased or stopped, gastric decompression should be initiated, and promotility agents should be started. Pain medications should be decreased, and IV nutrition and hydration should be started. With the endocrine system, GBS puts the body in a hypermetabolic state. This means the body's metabolism is running at an increased rate. Because of the hypermetabolic state, the body needs a high-protein diet to avoid weight loss. A hypermetabolic state is caused by too many hormones coming from the thyroid that result from elevated TSH levels. This hypermetabolic state can be a response from stress because of an illness, infection, or injury. GBS can commonly occur after an infection. The infection that occurs can amplify the parasympathetic-sympathetic reactions. This can lead to inflammation and can activate an abnormal hormone response. This is shown by an increase in catecholamines and other hormones to produce the hypermetabolic response. The degree of the hypermetabolic response is dependent upon the severity of the illness, injury, or infection and the host's response to it. The musculoskeletal system is affected greatly by GBS. GBS is characterized by ascending muscle weakness in children. This usually happens symmetrically. Limb pain and gait disturbances occur because there is a loss of tendon and muscle reflexes. This usually creates difficulty with walking and standing. In children, gait disturbance is an early clinical symptom. Pain is also common in children and occurs in their limbs, neck, and back. There can also be weakness in the upper extremities due to the demyelination of the nerves. Guillain-Barre Syndrome is a disease that affects the peripheral nervous system. Usually, the immune system only attacks invading foreign bodies. With Guillain-Barre Syndrome, the immune system starts to attack the protective covering of the nerves, also known as the myelin sheath. The myelin sheath is what helps to transmit nerve impulses. Without the myelin sheath, the nerve impulses don't get transmitted and can lead to numbness, weakness, and paralysis. Because of the demyelination of the nerves, the sensory system is also affected. The demyelination causes paralysis, weakness, and paresthesia. As the nerves weaken, the feeling of the extremities or other areas can be lost or altered. Prolonged immobility puts the patient at risk for nerve compression related to positioning. Patients who are intubated or sedated and have sensory loss are at significant risk and injuries can occur. These can be prevented by pressure point padding, careful body positioning, bracing, and frequent position changing. Prolonged immobilization can lead to skin sores and wounds. Sores and wounds can lead to infections if they aren't treated properly. Thorough skin assessments need to be performed to find any skin alterations early. Frequent repositioning, careful body positioning, and pressure point padding will help to prevent these from occurring. Guillain-Barre syndrome is an immune-mediated disorder. Epitopes appear on the surface of the peripheral nerves, and the body mistakes these as an infectious disease and ends up attacking its own nerves. Epitopes are part of an antigen that is recognized by the immune system. The acute inflammatory demyelinating polyradiculoneuropathy, also known as AIDP, is a type of GBS and is an autoimmune neuritis. The cause of this is T cells are directed against peptides from the proteins of the myelin and attack them. There are also other axonal subtypes of GBS. These are axonal neuropathy, also known as AMAN, and acute motor and sensory axonal neuropathy, also known as AMSAN. These are caused by antibodies to gangliosides on the cell membrane surrounding the axon that make macrophages invade the axon and attack them. The main step in the onset of GBS is put forth by an immune response. If Campylobacter jejuni is the cause of the GBS, it contains lipo-oligosaccharides, which is a carbohydrate makeup located on the membrane. This imitates the gangliosides in humans. Autoantibodies cross-react with the gangliosides and are aggravated by infections. They attack the peripheral nervous system by activating complements. Complements take part in attacking the cell membranes. Risk factors of GBS. Modifiable. The modifiable risk factors include having surgery, getting immunizations, and the use of epidural anesthesia. These are things that parents can choose not to do for their children. The child only getting surgery when absolutely needed and not using epidural anesthesia will lead to less cases of pediatric GBS. The risk factor that could have a huge impact is a parent choosing to not get their child immunized. Not getting immunizations can lead to other problems, such as outbreaks of other diseases in the areas they live. The outbreaks of these diseases would be more likely to occur when they live in an area where multiple children don't get vaccinated. When a majority of children get vaccinated, there is still herd immunity, and the chance is small for the disease to break out. If a child is not immunized and contracts one of these diseases, it can put a financial strain on the family because of hospital bills and treatments. Another large cost can come from trying to contain the disease so others who are at risk don't get it. Children who get their vaccinations do have an increased risk of getting GBS, but pediatric Guillain-Barre syndrome occurring from vaccinations is a very, very low number. Some of the non-modifiable risk factors would include the child getting an infection or virus that could lead to getting GBS. These are hard to change because a child could be exposed to these and not know it. When the child is exposed, they would have a chance of getting Guillain-Barre syndrome. Another non-modifiable risk factor is being male, because more males have a tendency to get this illness than females. Prevention of GBS. Primary prevention means to stop the disease before it happens. With this disease, primary prevention would be to educate the community about Guillain-Barre syndrome and how it can occur. Prevention could occur by educating the family about frequently performing hand hygiene, keeping the kids away from those who are sick, parents cooking meats to adequate temperatures, and keeping raw meats away from other foods to avoid contamination. Also having the child only have surgery if absolutely necessary and not using epidural anesthesia. Secondary prevention means to try to decrease the severity of the disease once it has already occurred. With this disease, there are treatments that are proven to help lessen the length and severity of the disease in children. These are the use of plasmapheresis and intravenous immunoglobulins. Monitoring for complications in all body systems would also be important to lessen the impact of the disease. Tertiary prevention means to manage the effects of ongoing illness and long-term symptoms. With Guillain-Barre syndrome, there can be long-term symptoms that can last months to years. These are usually managed with therapy programs and counseling. The child should also continue to be seen by their primary doctor and specialists for continued management of pain and paresthesia. Nursing interventions and treatments for GBS. Some of the nursing interventions for GBS would be managing and assessing for symptoms of respiratory failure, such as the child's need for oxygen and mechanical ventilation due to respiratory muscle paralysis. Managing and assessing for symptoms of dysautonomia, such as hypotension, hypertension, arrhythmias, and tachycardia. Managing and assessing for symptoms of hyponatremia due to SIADH and natriuresis. Assessing the need for Foley catheter due to urinary retention. Frequently assessing pain and need for pain medications, especially in children. Using muscle relaxers to prevent spasms, and using tricyclic antidepressants or anticonvulsants such as gabapentin to treat sensation problems like numbness and tingling. Corticosteroids are not recommended for use and can make Guillain-Barre syndrome worse. Assessing for ileus or bowel obstruction and initiating tube feedings, IV hydration, and IV nutrition if needed. Treatments for GBS are plasmapheresis. This is when blood is taken out of the body and goes through multiple filters that divide the blood cells into their separate parts. The cells are then put into a donor plasma and returned to the patient's body. The plasma from the patient is gotten rid of. This process removes the matter that has been damaging the myelin. Plasmapheresis can alleviate the GBS symptoms, prevent paralysis, and overall shorten the length of time the patient has GBS. Intravenous immunoglobulin, also known as IVIG. The use of IVIG is just as effective as using plasmapheresis and is actually the preferred method of treatment because of convenience and availability. The dose of IVIG is based on the patient's body weight and is given to them daily for 5 days. The use of both IVIG and plasmapheresis is not better than using IVIG or plasmapheresis alone. Therapy should be initiated as soon as possible before recovery even starts. Therapists move the patient's arms and legs to prevent soreness and stiffness. Frequent repositioning is used to prevent nerve compression and pressure ulcers. Once the GBS symptoms decrease, the therapy team will start an exercise routine to help the patient regain their strength. Counseling is also recommended. It is recommended they see a counselor to talk through any problems or complications that come up. Counseling can help them feel better about the treatments they are doing and their recovery process. The use of technology associated with GBS. Technologies are used in multiple different areas when it comes to GBS. Technology is first used in the diagnosis of the disease. Electrodiagnostic studies are used to test the nerve conduction and muscle reflexes and look for any kind of impairment. A lumbar puncture is done to test for proteins in the patient's cerebrospinal fluid. MRIs can be completed to rule out GBS and look for lesions, nerve root enhancements, or other abnormalities. Technology is also used in the treatment of the disease. Machines are used to monitor vital signs, administer hydration, nutrition, and medications. Technology may be used if the patient gets paralyzed respiratory muscles and needs to be on mechanical ventilation. It is used in plasmapheresis, where the patient's blood is taken out, separated, and then the blood cells are given back to the patient in donor plasma. Technology is also used to administer the treatment of IVIG. When these treatments are being performed, there are multiple different machines that are monitoring the patient to make sure they are staying stable and not having any respiratory or cardiac changes. It is recommended that technology should be used to manage and treat the disease. It should be used for administration of drugs and in helping to assess the patient and monitor the status of the patient's respiratory and cardiac status. It should also be used to administer hydration and nutrition if needed. In treatment of the disease, it should be used for plasmapheresis and administration of IVIG. It should also be used for continuing monitoring while these procedures are being completed. This is the concept map I came up with for Guillain-Barre syndrome. I wanted something that was simple for someone to look at, to get a quick glance and see the causes, symptoms, how it's diagnosed, what is being used to treat it, and some of the nursing assessments that are used. Guillain-Barre syndrome is a serious disease in children. The disease is more likely to occur in children because of an infection or virus. Other risk factors that could cause the disease are surgery, immunizations, and epidural anesthesia. This is a disease that affects every body system and can be debilitating and require mechanical ventilation. The good news is there are treatment options that help to decrease the length of the disease. A majority of children recover much quicker than an adult would, and most of them make a full recovery. And then these are my reference pages.